Hey everyone, in today's video, we're going to see about COVID-19 and erectile dysfunction. I'm Dr. Natesh, men's health consultant from Tamil Nadu, Amazon Clinic, Trichy. Recent research have shown that COVID virus is present even in the penile tissues. And this could be a very remarkable finding so that we have now a direct correlation of the presence of a COVID and erectile dysfunction, because previously many researchers were saying that COVID infection can cause erection issues, but they couldn't prove what could be the probable cause of this. But now few researchers from the University of Miami, they have proven that with few evidences, and I'm going to show at the end of the video. So in the beginning of the video, I'll be telling about why COVID and erection difficulties is happening, and what are the other medications for erection difficulties, and why these kind of medications are failing for these COVID patients. Let's go to this video now. So you consider this as a vascular surface. So this is a vascular surface, that is vascular surface, the outer surface of any blood vessel, that is arteries. This has a projection called as ACU2 receptors. Basically, receptors are signaling responders because they want to convey, they want to take few signals from outside the cell and bring it inside the cell. So basically what is happening here, this COVID virus, with the help of its spike protein, it is going to get attached to this ACE2 receptors, and these ACE2 receptors is going to internalize this COVID and it is going to bring inside it, because this is an outside of the cell and this is an inside of the cell. So basically this ACE receptor helps in the entry of COVID. Now, why it is so significant? Because these ACE receptors are present in lungs, kidneys, testis, and is more commonly found in men. Therefore, they have found out that COVID infection has a high affection or a high rate of infection in case of men. Most importantly, these ACE receptors are widespread on the blood vessels. And I'll tell you why there is a significance of this ACE receptors and the blood vessels. For that, you should know about the penile vascular anatomy. What we see outside, that is this part of the penis, is what people see outside. But penis structure is almost present till the level of anus. This is the level of anus. And this is full of blood vessels. It's completely of vasculature with a less amount of muscles in that. When you ask about a postpubertal guy, who, like, which is your strongest muscle, he always point out that it's my penis because I get good erection. I'm so strong. It is not always true, because erection has a less thing to do with the muscles. It has more to do with only with the blood supply and the amount of blood flow to the penis when there's a demand, that is really the sexual activity. So this is a very good picture which is showing you there are two major arteries, and these major arteries are giving the multiple branches inside the corpora cavernosa, that is the penile tubes. As you can see from this picture, penis is completely studded by blood vessels. So you consider the most vascular organ to be the penis. And you can see from this picture that this main artery has given multiple branches, and these branches are covered by something called as cavernosal smooth muscle cells, CSMC. So this CSMC has to relax. So when the patient is tense, when the patient is smoking, or when the patient is obese, this smooth muscles are going to get stiffened. Therefore, even when the blood supply is uninterrupted, the penile arteries won't relax, and therefore the patient might not having a good erection. Sometimes the blood supply itself is impeded. That because that could be cholesterol in the blood vessels, or the blood flow is low because of less amount of hormones. There are multiple reasons. So you should understand that this is the penile artery, and these are the structures, and this is very, very important so that you can understand why there is going to be a COVID infection and why this is going to affect the penile arteries. First, know about basically about the erection physiology. For any erection, you need a sexual arousal, right? You need to get sexually aroused, either by seeing a person, or by seeing a video, or by anything you get aroused, or by imagining, fantasizing. First step is sexual arousal. Then comes stimulation of the nerves in the penis. And the third is release of the neuronal nitric oxide synthase. Very, very important step, because this initial step will lead to the cavernosal smooth muscle cell relaxation. This gives an initial tumescence. of the penis. It's called as not erection fully. It is tumescent, because erection has to be very stiff for any man to penetrate. With this kind of a tumescence, he may or may not be able to penetrate. For the further augmentation of the tumescence, there has to be an increased blood flow into the penis, and this is going to be maintained by the endothelial nitric oxide synthase. So, with the augmentation of the eNOS and the compression of this subclinical plexus of vein, there is going to be a rock hard erection, which is going to help the man to penetrate the vagina. So, this is a basic of erection. So, please understand this. So, erection has a multiple step processes. So, ultimately, this is due to the eNOS production. It has to be sustained for a longer period until he is going to complete his erection activity. Now, erection has various causes. It could be hormonal, it could be obesity, it could be high homocysteine, low vitamin D. Causes are many. As people tell that erectile dysfunction is a symptom of an underlying disorder, not a disease per se. Now, let us see about the grades. Why this grading is important? Because when patients come to us, he simply tells that I'm having an erection difficulty. We may not know how severe it is. So we'll be giving him 4 type of sponges. So, and he'll be asked to press the sponge, and depending upon his sponge softness, we get as grade 1, 2, 3, and 4 kind of erection. Grade 4 is hard erection, which is normal. So grade 1, 2, and 3, we used to tell them, okay, you have this kind of an severe grading. So grade 1 is penis is larger, but not hard. Grade 2, erection penis is hard, but it is not hard enough for penetration. And grade 3, penis is hard enough for penetration, but he cannot completely hard. So which termed as grade 3 as mild ED, that is erectile dysfunction, and grade 2 as moderate ED, and grade 1 as severe ED. So based on this, we understand how severe the patient's issue is. So there were various treatment options for erectile dysfunction. The first were the injectables. It was very painful. So people are using it for multiple reasons, and people used to self-inject these drugs on the penile tubes. And then came intraurethral alprostadil. But these drugs, it came with irritation, some kind of an pain, some kind of a discomfort for the patients. Then came the era of Viagra. It completely revolutionized the treatment for erectile dysfunction. The first of the drug is sildenafil, or tadalafil, the further components are tadalafil, vardenafil, sildenafil, and so on. These drugs, they act by inhibiting an enzyme called as phosphodiesterase 5. I'll be telling you the significance of this enzyme in the upcoming slides. As you can see from here, before knowing about the PD5, you should know about what is eNOS and the importance of its erection. Basically, for erection to happen, I'm going to tell this cyclic GMP has to be produced. For that, we need endothelial nitric oxide synthase. Please remember the previous slide. This endothelial nitric oxide synthase is very much responsible for maintaining or sustaining the erection for a long time. So then these kind of further downstream pathways happen, which ultimately lead to the cavernosal smooth muscle cell relaxations. And finally, that has to be penile erection. So to sustain, again, please remember that you need eNOS. So if the patient is having some kind of an erection issues, he must be producing a lesser amount of eNOS. So there are no drugs currently available which can increase this eNOS. So what we can do is we can increase the activity of this component, because when there is sustained erection, it is also trouble. So body generates an enzyme called as PDE5, that is phosphodiesterase 5, to inhibit this kind of an enzyme, so that there is an erection. And when the brain senses, or when the patient doesn't want erection, this PDE5 goes and breaks this down, and the erection goes off. So what we're going to do, we're going to devise drugs which can inhibit this enzyme, thereby increasing this cyclic GMP, thereby promoting this downstream pathway. The main restriction in this kind of drug is there has to be some amount of eNOS product. When there is no eNOS and there is no a small amount of cyclic GMP, there is no point in giving these kind of drugs, namely Viagra, as I told you, sildenafil, Cialis, everything over there. Understand about this endothelium. So this is the inner structure of the blood vessel, called as endothelium, the middle layer, and the outer the collagen fibers. This is what is happening all over throughout the body. Anywhere if an artery, this is going to be happening here. So the endothelium produces massive amount of eNOS to keep the blood vessels dilated all the time. It could be even heart vessels, it could be a brain vessels, it could be kidney vessels, it could be even a vessel on my finger. This is what is happening in the penis also. So when the endothelium is healthy, it is going to produce a lot of eNOS. So there has to be a constant replenishing of the endothelium. That is where this endothelial progenitor cells come into role. Every cell has its lifespan. It could be few days, it could be few weeks, it could be few hours. So depending upon the cell's life cycle, the stem cells, they regenerate the cells reserve. So when it comes to the endothelial cells, the stem cells for them is endothelial progenitor cells. So when there is a sufficient amount of EPCs, it is going to put new amount of endothelium into role, like into the blood vessels. Thereby, there is going to be a sustained production of eNOS. And this also helps in the new blood vessel formation. So when there is a low amount of eNOS, that's no erection. When there is low amount of EPC, there is no endothelium at all. Ultimately, there is no eNOS, no erection. So please understand this concept, because based on these two concepts, the researchers have found out that these two are completely affected in case of COVID patients. I'll tell about the more details in the upcoming slides. So you should understand that erection is nothing but a vasodilation along with few other processes. For that, we need a healthy endothelial progenitor cell count, and we need a healthy endothelium, which is ultimately going to produce eNOS. Apart from this drug therapy, we have the called as PRP, or endothelial progenitor cell therapy, which we inject into because we take these kind of cells from the patient's bone marrow, then we inject again directly into the penis. This is pure experimental. Still, there are no conclusive evidences that which patients are beneficial, but still people are researching on this. They are very specifically being for diabetic patients. And the this is known as shockwave therapy. This shockwave therapy, again, it improves the blood supply by recruiting the stem cells, and it is going to loosen up the cavernosal smooth vessel, because research is saying that whenever there's an arterial stiffness, it is going to affect the erection. I'm not going to go into it, because you should know that there is a drug therapy, there is an EPC therapy, there's a shockwave therapy, and when these are all going to work, because the patient is not having any kind of eNOS or EPC functions, the final one is a penile implant. These implants are kind of a very cumbersome procedures, but when done with the right people, the effects will be phenomenal. Why? Because we're going to completely abolish all those eNOS, EPC and all. There'll be a surgeon, there'll be a urologist who inserts a flexible tube or a rod into the penis, depending upon the cost. There's a malleable thing, there's an inflatable thing, or there's a soft implant. Again, I'm not going to go into much detail because it's a separate topic of itself. Just remember that there are treatments. Why? Because the patients who have been recruited for the research for the COVID study were patients who underwent the penile implant surgeries. So this is how it looks. So once it open, this is a bottom portion of the penis. They will insert two sorts of tubes like this, and these tubes will help to take away all those tissues from the penis area. So based upon this, they're going to create a vacant space over there, and they inject them on the inserted tube over there. So these tissues can be used for further analysis. That is what has happened for this research. So basically, for the research, they did for four patients were elderly patient around 65 to 71 years of age. And it's very thing that the Indians, when somebody is of this age, they'll never, and after getting COVID, they never even think of, mostly they never even think of surgery, because it is US who gives more importance to sexual lifestyles on the well-being. So they openly tell, okay, I'm having this kind of problem. And because of this research study, it is fully, like, it could be funded. So they came forward because there was no cost implied for them. So the two were COVID positive patients and two were COVID negative patients. The main caveat here is that those COVID positive patients, they claimed that they were having normal erection before the research study, because that could be bias also, because there was no training available for them to tell how much was the erection difficulties, how much was the severity of the ED. And I'm not going to much detail about that. So these two patients one was severe COVID, was hospitalized, but who never had any heart disease or diabetes. Very important, because heart disease and diabetes can itself have impact on the erection. But this patient underwent a prostate surgery, very specifically robotic prostate surgery, because robotic prostate surgery again says that the chance of erectile dysfunction post-surgery is less. And the second patient is mild COVID, but he had significant heart disease and hypertension. And the rest two are non-COVID, but had ED. So we had 4 patients who were having erectile dysfunction. 2 had COVID, 2 didn't have COVID. So what they want to see? They want to see the endothelial progenitor cells in the blood. Remember this slide. So this is what they're going to measure. So amount of endothelial cells, endothelial progenitor cells in the blood. Because once it is going down, it is solid evidence that COVID is affecting the EPC's functioning on the production. And they took the tissues, which was taken after the implant. They tested for the RT-PCR, COVID RNA. And they even subjected those tissues for a electron microscopic analysis. And further, they did a immunohistochemistry study. So they want to find out the amount of eNOS over the endothelium. So this is a electron microscopic structure of the COVID inside the blood. So this was a reference picture. And this picture was taken from the article. This picture very clearly shows that so there were viral-like particles inside the penile tissues. So this is the first study which has shown with evidence that there was the presence of COVID or viral-like particles inside the penile tissues who were having erectile dysfunction post-COVID infection. And this is a very superb slide, non-COVID patients and COVID patient, and this is showing that there is less amount of eNOS. You can see here, eNOS has been stained with a very special staining. So when the cells are having high amount of eNOS, it stains like this. And when they're not having eNOS, they stain very dull or very mild. So this shows that patients with COVID had less expression of eNOS. So ultimately, to summarize results, they have found out that post-COVID, patients were having 0 EPCs or very, very, very few amount of EPCs. That is endothelial progenitor cell count in the blood. Very, very good evidence to show that the cause of ED in these patients is completely disruption of the endothelium. As you can see from here, along with this, there is also decreased eNOS expression. Plus, they have found out that there was COVID-like particles inside the penile tissues, and the penile tissue was showing positive for RNA. So please remember that once COVID is affecting, it is going to affect all parts of the body, and slowly, one by one, we're going to see and which part is getting affected, because they have found out even COVID is affecting the testicles, that are decreasing the sperm count, and COVID is having this mucormycosis. It affects the taste, it affects the lungs, it affects the GIT. It is not sparing any organ. So please remember that the best way is to protect yourself. And this is not the first of the study. And these studies there were multiple studies which are showing that this COVID can cause endothelial damage. But the first study which showed that the COVID is present in the human penis is this study from the Miller School of Medicine, is from the USA. So therefore, stay safe, wear a mask, get vaccinated, do exercise yourself, right? Cardio or yoga, have good food, and have safe sex, but not casual sex. Now, what I mean here by casual sex, because there are many young guys or girls who go for this Tinder sex or some kind of like flings. And for many people, their spouses or partners or friends might be staying somewhere else. So when you meet a person whose status of exposure is unknown, always have a caution of having intercourse with them. If the intercourse is unavoidable, always please wear a mask, and please avoid kissing, because again, you can also have a penetrative sex. So there are fixed guidelines for how to have sex to avoid COVID infections. Please refer it. And so stay home and stay safe. If you have any doubts, please drop in the comment section. I'll be more than happy to help you out. And see you around for the next video. Take care.